Welcome back to another episode of Your Fitness Consult. I am Dr. Mayer. I'm so excited for us to be here. This is part 2 of the Masterclass in Gut Health. As you can see, I'm not recording from my powerlifting gym. I know I've been there for quite a few of the episodes. Today is a rest day for me. It wasn't supposed to be. I did day 1 of my program last night, and I was supposed to do day 2 tonight, but I went to work. I work overnight in the hospital, and I went in for a few extra hours after I did my lower body workout. And then I found it to be about 5 in the morning when I was ready to leave, but I had to pick up my wife from the dealer. She was dropping off our car around 7:30. So I didn't have time to sleep. So what did I do? I went to my second gym of the night, not my powerlifting gym, but to my commercial gym, and I got in a bunch of cardio. I did wall balls and sled pulls, sled push, row machine. I am training for a high rocks race, so I usually focus more on powerlifting and strength training, and I'm still doing that as my strength training workouts, but I've been really trying to train for this high rocks race because cardio is just not something that I gave priority to before, so really trying to up the cardio. That's also going to help my calorie deficit. I'm trying to do this while in a calorie deficit. And, I have not been the most committed to this calorie deficit. When I finished my last powerlifting competition a few months ago, I said, okay, I'm off the bulk. I was bulking for most of the last couple of years / in maintenance. I said, time to lose some weight. And I did lose an initial 5 or 6 pounds. And then, I don't know, summer started. And I understand how tough it is for all of you out there because it's tough for me too. And I said, hey, maintenance is actually pretty sweet. And this deficit thing, not so much. And so I focused more on a maintenance. And I put a couple of pounds back on, as you do when you start eating more carbs. But I'm recommitted to the deficit. And I have been keeping track of everything. I've been actually doing some calorie cycling, in which the days that I'm going to have these heavier workouts, more intensive cardio workouts, I tend to eat more calories. And then on days that I either rest or maybe have an easier strength training day, which for me tends to be maybe an upper body day, I'll eat a little bit less. But overall, for the week, it'll balance out to a calorie deficit. That is more of an advanced way to do things. There's nothing wrong with it. It can just get a bit complicated, but I've never done it before and I'm trying it out to see if it works for me. So juggling a lot right now with all of that. In addition, I'm studying for my recertification of my internal medicine boards. So that's taken up a lot of my headspace as well. But I'm excited to bring to you any topics that I come across while I'm restudying and recertifying that we can talk about here on the podcast. So look out for that. I'm going to get some inspiration from studying for my boards. So here we are now. I'm on rest day today because I got too many workouts in over the last 24 hours for me to even try to put my body through that again. Rest and recovery is so important, especially at my age. I'm 44 years old. I've just started perimenopause, and I have to give myself and my body time to relax, to recover, give my muscles some time to recover, my connective tissue, more importantly, tendons and ligaments, and just let things in repair. And then I'll be ready to get my next workout in tomorrow. So here we are, part 2 of our masterclass in gut health. In part 1, we spoke about the gut microbiome, what it is in a healthy state, what it can do for us, and then in a dysbiotic state, how that affects us in so many ways. And that includes not just our GI sensation, symptoms, vomiting, nausea, GI upset, diarrhea, constipation, but also everything else. The gut-brain axis, it affects our mood and our cognition, if we feel foggy or not. It can affect our hormones. It can affect our energy levels. It can affect our immune system. So we went through all of that. We touched briefly on irritable bowel syndrome. We did talk about prebiotics and probiotics. And so now here we're in part 2. We're going to go into a little bit more depth into the kinds of foods that we put into our body and how that affects our gut microbiome. So let's start with fiber. So fiber is something that if you're not tracking, you definitely should track. In addition to tracking calories and your 3 macros, your protein, your carbs, your fat, fiber should be that most next important thing that you're able to track, because most Americans are not getting enough fiber, and fiber is so important. A lack of adequate fiber has been linked to so many things, from constipation all the way up to colon cancer. So it's so important that you stay on top of your fiber, especially since we are in a culture in which that is lacking. We're in a culture in which a lot of the foods out there, prepared foods, takeout foods, they just are not high enough in fiber. And so it's really something that you have to focus on, make sure you're getting enough of it a day. As an aside, if you use the tactic on a calorie deficit, like I do, of with every meal, try to have a vegetable and a fruit with it, you will get enough fiber by the end of the day. I spoke about in one of my previous episodes how, most days I tend to have raw carrots and celery and spinach, maybe cucumbers. I try to get all of those good vegetables in. I have a ton of fruit too. This time of the year, it's been so great. I've been really enjoying nectarines and cherries and watermelon, although watermelon doesn't have a lot of fiber in it. But, in general, most fruits and vegetables do have adequate amounts of fiber. So if you prioritize that with your meals throughout the day, then you should be able to hit your fiber numbers. If you wanted to try this little experiment, because I try to do that when I try to get out of eating my fruits and vegetables, like today, for example, have a sandwich. I had half a sandwich, and I wanted the whole sandwich, but I'm on a calorie deficit. And I said I can eat the other half later, but I knew that wasn't going to be fulfilling for me. So what did I do? I had a bunch of baby carrots, probably around 100 grams of baby carrots. And then I also had a nectarine. So I ate half a sandwich. I had a nectarine. I had baby carrots. I had some water. I had my coffee after that. I was full. That lasted me 3 or 4 hours. And then I repeated that again with the other half of my sandwich, with now spinach and then cherries. And that took me for most of the day then through, feeling full and satisfied. The fiber that's in those fruits and vegetables will leave you very full and very satisfied. But if you were to just eat that sandwich and nothing else, or even that sandwich and some chips, you would find that you would be hungry shortly after that. And so I've done this so many times in the past, trying to tell myself, no, today's going to be different, it'll be okay. But if you were to try that, you'll see that will leave you hungry, that you have to bulk up. Especially when you're trying to lose fat, bulk up on your vegetables and your fruit, bulk up on that fiber, and that'll make you feel fulfilled. So how much fiber should you have in a day? For men and women, the guidelines are different. For women, it is at least 25 grams. 25 to 35 is the recommended amount of grams. For men, it's higher. It's 35 to 45 grams of fiber a day. And again, this is something that you can easily track in any of the tracking apps like MyFitnessPal. So there are 2 general types of fiber. There's insoluble fiber and there's soluble fiber. Soluble fiber is fiber that will dissolve in water to form a gel. And this gel-like substance is then absorbed by your colon into the stool, and it softens the stool. And then in that fashion, it helps it pass through, because now it's nice and soft and it can glide right through the rest of your GI system. In that process in which it kind of glides through, it doesn't do it fast. It actually kind of slows it down, but it helps give it a nice smooth pathway down. Fiber in general is an excellent prebiotic. As we spoke about in the previous episode, you don't have to take prebiotic pills, supplements, and you shouldn't take them, because again, if you are committed to being on a calorie deficit, to losing fat, you should be incorporating fruits and vegetables into your diet. You'll find all of the fiber that you need there, and you'll find all of the prebiotics that you need there, because fiber is prebiotics. Fiber is the food for your gut microbiome, for the bacteria in your gut. And so you're already taking in your own prebiotics, and you're getting all the other benefits that fiber gives you. So you do not need to waste your time on getting supplements. You do not need them. Do not listen to anyone who tries to sell you the prebiotic supplements. You get no additional benefit from taking it by a pill than actually ingesting it yourself via fiber, via fruits and vegetables. So what are some of the foods that are high in soluble fiber? So those will include citrus fruits like oranges, apples, berries. It'll be in grains like oat and barley. It'll be in your legumes, beans, lentils, mushrooms. You can find it in sweet potatoes. Root vegetables like onion, garlic, broccoli, asparagus are also excellent with soluble fiber. Now, you don't have to keep track of exactly what percent of the fiber you're taking in is soluble versus insoluble. That's just going into way too much detail that you don't have to worry about. And again, if you're eating enough fruits and vegetables, you'll get enough of everything that you need of enough types of the both types of fiber. But in general, you want 1/3 soluble to 2/3 insoluble fiber. So if you move on to insoluble fiber, so insoluble fiber is something that is not easily digested by your GI system. It does not dissolve in your stool. So because it's incorporated into the stool, so it bulks it up and it speeds digestion, where soluble fiber will slow down digestion, although make it nice and smooth. Insoluble fiber will speed up digestion, and in that way it also does its thing in helping to prevent constipation and promote regular bowel movements. So where can you find this? You can find this in raw carrots. Soluble fiber is cooked carrots. Insoluble fiber is raw carrots. You will find it in your grains such as whole wheat, brown rice, bran, different nuts and seeds. In terms of your greens, it'll be kale, green beans. Brussels sprouts will give you a good amount of both soluble and insoluble fiber. Regular potatoes, including the skin, and certain legumes, beans as well. There's a few things to keep in mind when you're increasing your fiber intake. One is you want to do it slowly. Don't go from not eating a lot of fiber / fruits, vegetables, then the next day eating all of it, because that will wreak havoc on your GI system. You need time to gradually build that up so that your body gets used to processing that fiber. Second thing to keep in mind is you need to drink way more water when you are actually increasing your fiber and have an adequate fiber intake. And there are two reasons for this. Number one is that will help the soluble fiber to dissolve in your stool because it needs water for that. And number two, that insoluble fiber also needs water because it bulks up the stool and hardens it. So you need water so that it doesn't completely harden the stool and then not actually help with promoting movement of your bowels. So make sure you're drinking adequate amounts of water. You should be doing that anyway as part of your calorie deficit, but it's really important as you're ramping up your fiber and then as you're maintaining your adequate levels of fiber. Let's talk about fiber supplements. So just like with prebiotics, you do not need to take fiber supplements. There are certain people in which fiber supplements may be recommended for short periods of time, and that would be, for example, medically speaking, if you had an infection in your colon, a colitis, and then the infection actually resolved, but you're still having symptoms of gas and maybe diarrhea or constipation, bloating. Sometimes that can linger a bit after the infection is gone, and to help regulate your bowels back to normal, you may be told to take fiber supplements for a short period of time to help that process. Sometimes it is recommended for maybe our elderly patients who don't take in enough fiber to help keep their bowel movements regular. But again, these are usually medical reasons for this. The everyday person does not need to take fiber supplements, and you shouldn't take fiber supplements. You really should get your fiber through fruits and vegetables. I cannot stress that enough. And again, it's a waste of money for you to do that. I would rather you save that money and go get some of the seasonal fruit that's going to taste amazing. Go get the vegetables that you're into, and don't give those supplement companies your money. But let's talk about some of the fiber supplements. So let's start first with Metamucil. So Metamucil, the main ingredient is psyllium husk. This is a soluble fiber. As we've already discussed, soluble fiber will help it slowing down the movement of stool through your bowels, and it will soften it. Sometimes people with irritable bowel syndrome can do well with a psyllium husk supplement to help regulate their bowels. It can really help with preventing constipation or helping with constipation. but you can have side effects, as with all fiber, of bloating as well. If you've seen Citrusel on the shelves, that is methyl cellulose. That is also a type of soluble fiber. In this one, you might not get as much of the side effects of bloating and a gas sensation as you do with psyllium husk. You can still have it, but it may not be as prominent. And it does the same thing that psyllium husk does because it's a soluble fiber, so it helps to soften the stool. It helps slow down digestion and pass the stool. You may also have seen Benefiber on the shelves. The fiber in there is called wheat dextrin. That is also a soluble fiber. This tends to be not as strong as psyllium husk or methyl cellulose. It's good maybe for some mild constipation. You don't really get the symptoms of bloating and that kind of gassy feeling, but it may not be as strong as the other ones. And then finally, you may have seen Fibercon. Now, Fibercon is a calcium polycarbophil. That's the main ingredient. This is an insoluble fiber, so this will bulk up the stool. And so this might be good for people who have irritable bowel syndrome where the predominant symptom is diarrhea. And again, just to stress that if you do need fiber supplements, that most of the time you're told by your provider to take it for a very short period of time. These are not things you want to be on for the long term. Let's now change subjects to fermented foods. So whereas fiber is a prebiotic, fermented foods are probiotics. So as we mentioned in the last episode, probiotics are actual bacteria that's being introduced into your gut microbiome. You can buy over-the-counter pills for that. We talked about how you do not need that. Most people don't need probiotics. You'd be better off just trying to keep the bacteria, keep your gut microbiome happy instead of trying to introduce new strains to it. There are periods of time where you may be told to take that, such as when you're on antibiotics. You can look at the previous episode to hear more about that. But fermented foods are probiotics. They have bacteria in them. The process of fermentation involves taking something, let's say, we'll talk in the sense of food, take something like sauerkraut. Sauerkraut is made up of cabbage, it's carbs, and so you take the thing that has carbs in it, the thing that has sugar in it, you can add salt to that. You then can leave it open to air and allow the bacteria that's in the air all around us to populate that container, tighten it up. And then the fermentation process is actually the bacteria themselves feeding off of the carbs, the sugar that's in there, and the process is to release carbon dioxide through that fermentation process. And that's why you can get things like in kombucha, it's bubbly because that's the carbon dioxide. Also, there's a lot of fermentation processes in which you may take the item, you can put the item that is carbs, that is sugar, you can put salt in there if you want, and then you can actually add bacteria to it and tighten it up and let it sit. You don't have to actually let the ambient air kind of auto-populate whatever bacteria is in the air. But in this way, you're actually then, if you ingest that, introducing actual live bacteria into your gut microbiome. There's nothing wrong with doing this. You don't want to overdo it because, well, one, it can wreak havoc on your system if you start eating all the fermented foods right away. In the same way that increasing your fiber by too much can wreak havoc on your system. A lot of these foods have other benefits, and so they're not going to be harmful for you to take in. Just know that it's not necessary. Some people do feel that if they do have fermented foods on a regular basis, that it can ease some symptoms of gas and constipation. And that might be because maybe they were having an issue such as irritable bowel syndrome before, they were having some dysbiosis for whatever reason, and that may help temporarily ease some of those symptoms. There's really no hard science to suggest fermented foods as a treatment for any GI illnesses. The thing to keep in mind as well is that many fermented foods are usually high in salt and that you don't want to take in too high levels of salt. Some of the more common foods are kefir, kombucha, sauerkraut, kimchi, and yogurt. And again, if you are interested in fermented foods, just add them to your diet slowly. Okay, let's move on to the effect of eating different types of meat on your gut microbiome. So red meat and pork are going to affect your gut microbiome in the same way. Studies have shown that they can both actually lead to dysbiosis, which means that they can decrease the diversity of your gut microbiome, especially processed meats they're high in salt, they're high in fats, they have other preservatives in them. Those have been shown to actually irritate the lining of your gut. That can lead to bloating and constipation or diarrhea. It can interfere with nutrient absorption. And most importantly, red meat and processed foods have been linked to an increased risk of colon cancer. So this is not to say that you shouldn't eat red meat or processed foods or pork, but just keep in mind what it could be doing to your GI system so that you can eat every now and then. You can have them and it should be no issue. But you probably wouldn't be feeling well from a GI standpoint if red meat was your primary source of protein. And certainly you should be thinking about it in terms of increased risk of colon cancer. Let's talk about fish. Fish is an excellent source of protein. Our gut microbiome loves fish. Many fish are high in omega-3 fatty acids. That's good for cholesterol control. And in general, eating fish will decrease gut inflammation and it will help with gut dysbiosis. Now, it's just so much easier to digest for our gut than red meat is. Some of the fish that are high in omega-3 fatty acids are salmon, sardines, mackerel, but fish in general is very, very healthy for us and our gut loves it. And then finally, poultry. Poultry is another one that our gut loves. It tends to be a more lean protein, so there's less fat. It's very easy for our gut to digest. It does not irritate the lining of the gut. It does not lead to gut dysbiosis in most people. So fish, poultry are very easy on our gut. If you are a meat eater, you should tend to have a diet that's higher in fish and poultry than it is in red meat. Now let's talk about the effects of tobacco and alcohol on our gut microbiome. So let's start with smoking. Smoking has been linked to causing dysbiosis, meaning it decreases the diversity of the gut microbiome. It increases risks of ulcers, of heartburn. Nicotine speeds up digestion. So in speeding up digestion, it can cause diarrhea, and it increases fecal urgency, which is what it says, meaning that I have that sensation that I have to go to the bathroom right now. So nicotine can cause those issues. But most importantly, nicotine and tobacco use has been linked to many GI cancers such as stomach, liver, pancreas, and colon cancer. There really is no benefit to tobacco at all. So that's definitely something that if you are using, you should strongly consider working on cutting that out of your life. Alcohol can cause dysbiosis as well. Alcohol use tends to irritate the lining of the GI system. It weakens the intestinal lining. It can cause things such as gastritis, ulcers, diarrhea. It's just so caustic on the lining. You know, as someone who works in the hospital, I see patients all the time who have what we call alcoholic gastropathy, which means they have such an irritation in the lining of their stomach from the alcohol that they're drinking. People can end up vomiting blood, they can tear holes, ulcers in the lining of their GI system. It's really something that is going to make you feel like crap from a GI standpoint, from many other standpoints as well. Again, this is something that I'm not saying that you should stop altogether. I personally don't drink anymore. I'm not sober, I'm dry. I don't call myself sober because I think it does a disservice to my sober friends out there who worked so hard to have a better life by stopping their relationship with alcohol. So I chose to be dry. I did not have a bad relationship with alcohol before. I didn't really drink that much, but I chose it for many reasons, including I wanted better workouts and I wanted to be able to have consistency in my strength training goals so I can eat more food and not waste calories on alcohol. But also for this reason as well, because I didn't want to feel like crap from a GI standpoint. I didn't want to risk any of this. That's a decision for you to make for yourself, and if you enjoy drinking alcohol, just keep in mind just to keep it in a mild, moderate level of alcohol. And if you do feel that it could be linked to some GI symptoms, then you need to examine that relationship. Let's move on to ultra-processed foods and sugary foods. So ultra-processed foods tend to have a lot of preservatives in them. They don't tend to have a lot of fiber in them. They have chemicals. They can be high in fat. All of these things can cause irritation of the gut lining. It can cause dysbiosis. They've been linked to colon cancer. And if you're trying to lose weight and lose fat, they actually, because they don't have a lot of fiber in them, because they usually don't have a lot of protein in them, they're not very filling. And so usually you're not very satisfied when you eat the ultra processed food. So they tend to lead to overeating. So for all of those reasons, again, I'm not saying don't have these ever, but it would be good to limit your intake. With sugary foods, it's very similar. Foods high in sugar have been linked to dysbiosis. And this is the same with foods that have aspartame, sucralose, other artificial sweeteners. I know that there is a lot out there on how artificial sweeteners may not be as bad as people have said they were. But for this reason alone, I would stay away. And I have tried. I've cut out most artificial sweeteners. I do have my Diet Pepsi that I've still been holding on to. I would like to get rid of that in my life as well. But for the most part, I've cut out really all other artificial sweeteners for many reasons. We'll get into a future episode on that. But for this reason too, because they irritate the hell out of my GI system. I know if you take in a lot of these, you probably notice that it can tend to lead to some cramping, increased gas, distension. That's not just a side effect of them. That's them irritating the lining of your GI system. That's changing things on a molecular level. Again, anything that leads to dysbiosis, a change in your gut microbiome, can lead to all of the changes we spoke about in the first episode. It can lead to more inflammation. It can lead to fogginess. It can lead to increased mood disorders and of course, GI symptoms as well. So for that reason alone, it would be good to try to minimize your artificial sweeteners. Okay, so now that we've gone through that, the last thing I want to touch on for this episode is some of the other over-the-counter medications that people use to help their GI system, especially the ones that people tend to pick if they're constipated. We'll talk more about constipation actually in the third part. We're going to have a third part of the masterclass in the gut health, in which I'll go into more detail about what to do if you're having a ton of diarrhea or constipation or GI upset. When do you see a doctor? Is there anything you can do before that point? We'll talk in more depth about that. But there are a lot of over-the-counter medications that when people feel, say, constipated, that they reach for. And I just feel we should all be educated about them. So let's run through some of them. So we'll start with Colis, or Docusate is the active ingredient in that. This is a stool softener. This decreases the surface tension of stool. That allows water and fat to be absorbed into the stool. That will soften the stool, and then over time, that will help pass the stool because it is softer. You can have some mild stomach cramps. Most people do not have many side effects from this medication. This medication, though, isn't very strong. So it's not going to be a laxative where it pushes things out. It will just over time help to soften your stool. The average person does not need this. A lot of the times this is prescribed to elderly patients who, again, aren't getting in enough water or fiber into their diet. And so this might help keep them regular over time. The average person does not need this med, and if you're suffering from really bad constipation, this is not going to help you. The next medication is Senna, or Senokot. It's a senicide is the active ingredient. This is a stimulant laxative. So this really stimulates the bowels to start pushing things through. And it does this by irritating the lining of the bowels, which causes the increased contractions. It can be effective for helping you have a bowel movement. It's not as effective as some other medications, but as a result, you can have cramps, you'll have diarrhea. You don't want to take this medication for very long. You don't want to take any of these for very long if you do take them, because this just irritates the lining of your GI tract. That's how it works. So again, not good for your GI system. It's not that strong of a medication. I would only take it if you're told by a healthcare provider to take it. So while Senna is a stimulant laxative, Miralax is an osmotic laxative. An osmotic laxative draws water into the stool, and that will help pass things through by helping soften the stool. This can be more effective, say Senna. It might be a little more gentle than stimulant laxatives, but you can still have side effects of bloating and gas and diarrhea. And again, this is not something that you want to take for more than a few days, unless directed to by your healthcare provider. And then the final one we'll mention is Dulcolax, or Bisacodyl. This medication is another stimulant laxative like Senna. It tends to be stronger than that. There's a suppository you can get of it as well, in addition to the pill. So this is a very strong stimulant laxative, and it will do the same thing. It will cause contractions, irritate the lining of the GI system, and push things through. Same thing. You don't want to take this for long term at all. Let's move on to digestive enzymes. So Digestive enzymes, they're another thing that people are trying to sell you. I hear this like crazy. I actually was listening recently to Mind Pump Radio. I listened to them for a while, and then I dropped off because they got too involved in politics, and I didn't want to hear that from them. But I recently picked them back up again in looking at some of their videos on the powerlifting topics that I'm interested, such as deadlifting. And in the middle of that, an advertisement comes on for digestive enzymes. And I was so disappointed in them because I generally think that they give out good information. I think they've helped a ton of people. But advertising digestive enzymes is so irresponsible. They have to know that that's bullshit. Digestive enzymes, our body makes digestive enzymes. You do not need digestive enzymes to help with more digestion. I'm not even sure what they're trying to convince people you're lacking. Our whole GI system is full of digestive enzymes. Our mouth produces digestive enzymes that starts breaking down starch right away from our salivary glands. As the food moves down into our stomach, we have pepsin, which is a digestive enzyme that's released. That starts breaking down protein. It moves then the food that we're eating through into our small intestine. The pancreas will release actually enzymes that will break down all of our macronutrients. It releases amylase, which breaks down carbs, lipase, which breaks down fat, and protease, which breaks down protein. And then as you move into the small intestine is where you get your enzymes that break down all the sugars. So you have lactase, which breaks down lactose, sucrase, and maltase. So who needs digestive enzymes? There's a very small patient population that needs digestive enzymes. Those of you who are lactose intolerant out there, when you take lactate, okay, that's a digestive enzyme. You lack that. You need that if you're going to ingest lactose. That I totally get. There are some people who have chronic issues with their pancreas so that the pancreas doesn't produce the digestive enzymes that it normally should. So those people need pancreatic digestive enzyme supplements. But these are very specific supplements for very specific things. You do not need to take a general digestive enzymes. That's just a load of crap. Your body has the digestive enzymes that it needs. You don't get any additional benefit from these pills, from these other digestive enzymes. There's no issues with your digestion that requires these supplementations. Don't listen to them. It's a bunch of bullshit. It's a waste of your money. And shame on you, Mind Pump, for promoting that. I did want to throw a little bit in about collagen. So when we think of collagen, which is a protein, collagen protein, we usually think about it in terms of joint, bone, skin, hair, nails, promoting the health of those. That is all true. But it also can promote gut health as well, positive gut health, and decrease gut inflammation. It can improve dysbiosis, and it can lead to more regular bowel movements. So just another reason to take collagen. I take a collagen supplement every day. In the future, I'll have an episode on the things that I take every day. When I broke my foot last summer, that's when I started taking collagen because I wanted to promote healing of it. I wanted to do anything that I could that was shown to possibly help. And I've continued to take that because the studies out there on collagen, the conclusions are irrefutable in the positive things it does for us. So add this to the list. It promotes positive gut health. And then finally, I wanted to talk about these detox cleanse kits. I've only recently become familiar with these. And again, I think this is insane that people are selling this to you. You do not need to detox your gut. Your body in general is detoxed by your kidneys and your liver. Those are our filters that are getting rid of all of the things that our body doesn't use and doesn't need. And we expel it through our urine and through our stool. And so you don't need any additional detox kits. So I was curious, it's like, what's in these detox kits? How are people saying these work for you? So I looked into what the ingredients are, and most of these have fiber. They have digestive enzymes, things that, again, you don't need to take in a supplement capacity. You don't need any extra of that. You can have your own detox kit by taking in enough fruits and vegetables and fiber on your own. The thing that bothered me the most was some of them have laxatives too. And again, you can argue, okay, fiber is good for your body. Digestive enzymes are a waste of time. But laxatives actually irritate the lining of your GI system. It is actually something that's not good for you to take in the long term. So that one pissed me off the most. They're putting together these pills that have fiber, laxative, digestive enzymes. I don't know what else they throw in there, some vitamins, some other bullshit. You do not need to take these detox cleanse kits. It's not going to do anything for you. The best thing that you can do for your gut microbiome is to give it its food, which is fiber, which again, I'm a broken record at this point, which is in adequate fruits and vegetables, 25 to 35 grams for a woman a day and 35 to 45 grams for a man a day. That will make your gut the happiest. So that's the end of this episode, part 2. If you have any questions, please follow me on Instagram and message me. It's at Dr. Mayer. And my handle there is Your Fitness Consult. Everywhere else you can find me, Your Fitness Consult Podcast. But please follow me on Instagram, Your Fitness Consult. I'm Dr. Mayer. Send me messages, write in the comments on YouTube or Spotify any questions you have. I will be happy to answer any gut health questions that you have. And stay tuned for the 3rd episode. In the 3rd episode, again, that'll be the final episode. We'll go into details about the different disease states, talk more about irritable bowel syndrome, small intestinal bacterial overgrowth, when to see a doctor, what you can do for yourself, and how do you deal with symptoms of constipation and diarrhea. Thank you so much. I'll see you next time. For watching or listening to the podcast. This podcast is not meant to be medical advice. I'm a physician, but I'm not your physician. And this is not a binding physician-patient relationship. All of this is for informational purposes only. Please don't use this content to substitute for your own medical provider's advice. Please go talk to your medical providers about all the questions that you have, and please listen to their advice. If there's an urgent situation you find yourself in, please call 911, go to the nearest emergency department, and just know that medical knowledge always evolves. So while this may be current knowledge at the time, whenever you're listening or watching this, that knowledge may have evolved. Talk to you soon.